Welcome everybody to another episode of Coffee with ADHD Experts. This innovative series brings together some of the most eminent experts in ADHD and mental health in the world. We know that the demands on mental health services are rising. We know that this increase can never be met by professionals alone. So the question is, how do we think differently about mental health? What do we have to change? You are welcome to join us to enjoy this collective experience on ADHD across the lifespan. We will be sharing 3 short questions that can enhance our purpose as advocates and let other mental health professionals have the chance to listen to their experience. Let me now introduce you to Eleonora Giusti. She's PhD psychologist, Vice President of ADHD Chapter, AAP in Argentina, clinical psychologist and family therapist, professor at Palermo University, Buenos Aires, Argentina, Argentine Association of Cognitive Therapy member. And myself, I'm Norma Echavarria, MD and adult psychiatry, president of ADHD Chapter, AAP in Argentina, American Psychiatric Association International Fellow, a member of the World ADHD Federation, and also the American Hispanic Psychiatric Association in the US. So now we are getting the turn for Eleonora to introduce our guest today. So thank you.
Welcome everybody. Let me introduce to Dr. Anthony Rostain. He's a professor of psychiatry and pediatrics at the University of Pennsylvania Perelman School of Medicine, Philadelphia, USA. His clinical focus is lifespan neurodevelopmental psychiatry, which includes patients of all ages with attention deficit hyperactivity disorder, autism spectrum disorders, Tourette syndrome, learning disability, verbal and nonverbal, and related social learning disorders. He treats patients at the Children's Hospital of Philadelphia, where he is co-director of the Pediatrics Neurodevelopmental Psychiatry Service, and at Penn Medicine Behavioral Health, where he's medical director of the Adult Developmental Disorders Unit, which includes the Adult ADHD Treatment and Research Program. Dr. Rostain's research interests focus on improving clinical outcomes for patients across the lifespan with neurodevelopmental disorders and on creating effective service systems for the patients and their families. He has co-authored 2 books on the adult ADHD entitled The Adult ADHD Toolkit, Using CBT to Facilitate Coping Inside and Out, and Cognitive Behavioral Therapy for Adult ADHD, an integrative psychological and medical approach. And he's also co-author of a new book on college mental health entitled The Stress Years of Their Lives, Helping Your Kid Survive and Thrive During Their College Years, St. Martin's Press. He's also an APSARD member. APSARD is the American Professional Society of ADHD and Related Disorders, and it's working to improve the quality of care for ADHD patients through shared research, best practices, and evidence-based education and training. So, welcome to our new episode. Norma, the first question is?
Thank you very much. So now we're going to be asking you. Our pleasure, nuestro placer. As a researcher, psychology doctor, teacher, advocate, and being one of the main references in the field, what has led you to work with ADHD population? And in your opinion, how did your interventions make a difference?
Okay, well, first of all, thank you very much for having me. I'm delighted to be with you. I will add one little thing to my biography, which is I've moved from University of Pennsylvania, where I'm still emeritus professor. I'm now the chair of psychiatry at a different university across the river in Camden, New Jersey, called Cooper.
Sorry about that. Okay.
So I'm actually continuing to grow, and we're hoping to develop, and we are starting to develop similar programs here in New Jersey. I started off before going to medical school as a high school teacher in New Haven. And I taught biology and psychology. I was very interested in holistic health. This was many, many years ago. And I noticed I was very interested in some of my students who were very smart, but scattered. They didn't have their homework. They talked a lot in class, and I was curious about them, like what was going on. And I noticed that there was a group of these kids who needed help with getting structured, with being able to finish tasks. Some of them were also a little bit oppositional. And I spoke to a colleague of mine who was a psychiatrist visiting from Yale, because he was sort of spending time in the high school where I was working. And he said, those kids may have ADHD. I said, really? And in those days, I was very skeptical about medical treatments and hyperactivity. Now, we didn't like the idea of medicating children. And I was more into the holistic approach, Feingold diet and all this. So I go off to medical school, and lo and behold, in the medical school rotations in pediatrics and child psychiatry, I start to see the same kids, and I begin to read about this. And I began to develop a little more of an understanding that this was in the biopsychosocial model, that there were a number of children whose nervous systems were not quite up to the demands of the environment. They were a little bit delayed for their age group. And I found that interesting. And I went to Children's Hospital in 1980 to become a pediatrician. And in those days, there was no ADHD clinic. We started the first one after I realized through my pediatrics training that there were a large number of children who were basically not being adequately treated for this condition. And I got more and more interested with the notion that it isn't just the child, it was the family that was also affected. And of course, I got more and more curious. So not only did I decide I had to become a child psychiatrist, because I got more and more interested in this set of problems. Neurodevelopment became my mindset. Neurodevelopmental disorders, of which ADHD is one of them. But I also got very interested in integrated treatments, because I started spending time at the Philadelphia Child Guidance Clinic. I decided then to be trained in family therapy and cognitive therapy. I had learned dynamic therapy in my adult training in psychiatry. So by the time I was done with these 3 residencies and a fellowship, by the end of the 80s, I realized like this was my calling. I really wanted to become a part of the growing field of recognizing the impact of neurodevelopmental disorders, especially ADHD, in school, in occupation, in family life, in friendships. And the other thing that began to happen was we began to notice and see there were more and more of these patients who were adults who hadn't been recognized. So a bunch of things came together for me. Number one was the idea that you couldn't just look at this as a biological problem. It was a biopsychosocial problem, right? Very common, not well understood, lots of controversy over the use of medication. And I spent a lot of time as a liaison to the schools of Philadelphia. And I'll never forget, the superintendent of one of the school districts I was working with wanted me to come on a television show that he had. And he wanted me to talk about ADD and what it's about. So we created a 3-part series where I was basically talking to teachers and parents. And I even brought some of my patients on and some teachers.
Wow.
And we began what I would call public education about what is this ADHD. And believe it or not, even 25, 30 years later, sometimes that show keeps coming on the public television station of the school district. I mean, I literally had someone tell me they saw me on there a couple of months ago, even though that was literally, by now it's, boy, it must be 30 years ago almost, okay? But it just showed me how important education was to clarify the misunderstanding. So the first thing I think I've contributed to the field is really demystifying the notion of this difference in the brain, this neuroatypical brains that people have, right? And no 2 brains are alike, but people with attention problems really need extra help getting through the day. The other thing I noticed, which was very, very complicated, but hard to describe at first, was how the self-image of people with ADHD was suffering, that they began to feel like they weren't good enough, that they weren't meeting expectations. So psychologically, I noticed that a lot of these individuals, whether they were children, adolescents, or adults, they gave up very easily, or they kind of felt like they couldn't do it. So there was this internalized sense of not being able to meet the expectations, self-esteem issues, fear of trying certain things. So that by the late 90s, I teamed up with Russ Ramsey because I began to see these patients as they were growing up. I followed them over time, and we realized that there was a whole mindset that individuals with ADHD come to treatment with. Most of the time, it's a negative sense of one's abilities. And so we started to develop our cognitive approach. And so you can almost see now that the biopsychosocial means that we have to think about how we help improve the brain's functioning, but also the individual's psychological state of mind, and also improve the relationships, whether it's in the family or with school or with peers or with the job. So that's really how I can do what I'm doing.
It is extremely interesting, all the way, the pathway from where you were at the beginning as a teacher, but also interesting knowing that many adults diagnosed with ADHD now, and some of them get treatment. If they don't get this integrative approach, they are abandoning, they just quit. They do not have the time for changing so many things in their self-esteem, what they perceive they are. So it's very important what you're saying, Dr. Rostain, because we know it with Eleonora. We worked together for many years. So we know the importance of this psychological traits, you say, and how we are seen by others, and how we do really have this learned helplessness, right? When you have ADHD.
Exactly. That's exactly right.
Right.
The belief system is very, very dangerous. It's very, very profound, no? Very deep.
Yes.
So I've learned how to appreciate that you have to understand who the patient is, not just their diagnosis, but how do they see themselves, and how do they see their life and their future.
Yes, it's very, very important.
Let me answer. Now, one other thing that's evolved. So what's very exciting is I think that there are a lot of cultural issues and other issues that we talk about. For example, the expectations of our culture, and especially in Western culture, is that the individual must be able to manage everything on their own, right? Well, no, not really. We're all interdependent, right? We all need each other. So the first thing that we have to talk about is getting over the shame or the embarrassment of needing help, right? Oh, I should be able to do X, Y, and Z, but I can't. And so getting at this idea that no, we're interdependent creatures. We all need each other in different ways. And a person with ADHD needs to be able to articulate what it is they need. And if you're the parent of a child with ADHD and you happen to have ADHD yourself, that's even more important to clarify. Like, wait a minute, the job of being a parent, especially like the group that's the most stressed are working mothers. And if you're a working mother and you have ADHD, it's almost like the expectations are not realistic. So that's the next to say, it's okay to ask for help. Let's look at the expectations and the assumptions you have about, because sometimes what you really just need to do is just make a little bit less demanding life for yourself, delegating things, getting others to help, being able to put things down that aren't working and start over, change your approach. And getting the mind, so the mindset of our therapy is always inquisitive. Like, where did this idea come from? And how do we try and test it? And if what you're doing isn't working, what else might you try? And then, of course, in the last decade, the biggest change, the most exciting change, I mean, there are two big changes. One is, of course, the advances of neurobiology and understanding the commonalities among many different disorders, and how thinking neurodevelopmentally means that just because you're a certain age doesn't mean you've gained that level of skill, right? You still may need more help reaching whatever. So if you have a learning disability, the same idea, okay? social difficulties. Okay. And the second big change has been the mindfulness and the positive psychology movement, because what that allows us to say to people is now we have to work on self-acceptance and on being able to, give yourself a more compassion so that you're not overburdening yourself with more anxiety or with more demands than you can meet. Okay, so yes, you should keep trying, but when it's not working, to recognize that you need to take a break and to deal with the stress that may be making it harder for you to focus or to get things done. So I think that there's been a wonderful progression now into thinking about how positive psychology can contribute. And that means mindfulness, learning how to take care of your basic needs. And I know you both are working on those issues, and we've now begun to use the techniques of mindfulness and integrate them into what we're doing with, say, organizational coaching, helping people problem solve.
Tony, whatever, I'm sorry.
And the peer is the last thing you're
Yes.
developing. You have, which is amazing and important, is that people who all experience similar things can help each other, can build support.
Yes.
So what we're doing is we're changing the support system. I didn't mean to cut you off.
No,
Dr. Chip.
it's you have so many interesting things. I don't want to be just interrupting, but we, as leading this chapter in the Argentinian Society of Psychiatry, we hope to integrate not only this approach with Eleonora, that she, as a therapist, she leads the group, but also a mindfulness set, sports, because we talked many times with you. I don't know if you remember about rowing.
Yes.
I am a rower, and so I do put every single patient I have, kids, I don't see, adolescents or adults, and I say, which is the sport you're going to do? Pick one, or walk or run. We don't care, but this is also something we want to include as part of this integrative treatment. And the other point is not only just the integrative health care, but also nutritional approach, because
Yes,
we know obesity, and we know that the disorganized family, they are rushing. So what we eat and how we move our body and how we sleep and how we do this, understanding before and then accepting, is so important for us. So we deal really to develop this integrative model too. So I don't know, Eleonora, if you want
that's
to
the holistic. So that's the holistic approach, and we go back to the basics, right?
The basic,
Yes.
okay. I couldn't agree more in that, yeah.
Yeah, so basics: eating right, exercising, sleeping, having healthy hobbies that you enjoy, that relax you, and then making sure that you've got a support system around you.
And
because the thing I'm sure you're dealing with in Argentina, which still exists in the United States, is people go, oh, that ADD, that's not real, or they, there's still the people who make it sound like we're trying to push medications or something like that. There's still this mindset, and I keep saying no, we're trying to help people reach their potential, right? And the way to reach the potential is to see not just the deficits, but your strengths, right? So we use a very strength-based approach.
Well, we have an approach, I think, that it's also inclusive, because everything is, you do autism and also all these spectrum disorders that are for adults, because everybody forgets that also autism spectrum disorder kids grow up.
Yes.
So we need to have this inclusive model. And also think, and myself as part of this, what Dr. Barkley really published 2 years ago, I think, in Absurd, about longevity and the big cost in life. One of the things that it's very important, I think, for longevity, it's also social, how you say, it's like having your development of belonging in a social way. It's like connection. That's the word I was not finding. Being connected. Right. So for 20 years myself, I did these groups with ADD adults that most of all our psychoeducational groups, we need to understand what ADHD is. It's not your ADD, it's the same to others. We need to, after we understand, teach the important others that I have this and you have to understand. And the third is acceptance, because we're not going to be able to change everything. Lower your expectation. Meds are not like magic. Treatment should be tailor-made, right? You do it and you fix things in different moments in your life. Your approach is going to be different because it changes. So what you say is like belonging to a net where we can all connect and bring in the science to the people in a simple way is giving them understanding. And I really, I'm so connected with your way of seeing this that it's amazing to how you hear it. So.
Well, no, you know, you guys, that's exactly what you're discussing, the most important thing that's missing, right? Because the medical approach or even the psychotherapy, those are tools. But what really matters most is helping people find a comfortable place in the world where they can feel valued, where they can feel effective, even if they have problems.
Yes.
With less criticism from others or from self.
Yes.
And that's why I think your approach to psychoeducation is key and the support is key. So those things really, because what happens, and I'm sure it's happening in because of your work, that people can come out of the hiding and out
of the closet
and get beyond
negative
shame.
emotions. Yes, of course.
Out of the closet.
Anthony, according to what you are saying about the positive psychology movement and how is the ADHD research are evolving, don't you think that the name deficit disorder is doesn't reflect what we are saying today? So maybe in the future, Russell Barkley told us also, maybe you have to change.
What is he? Well, I don't know how he would change it, but I've always said that ADHD is a misnomer. And there's problems with this. It's wrong name. Okay. Number one, attention isn't something like that you have a deficit. It's like when you have a deficit of red blood cells, you have anemia. But blood cells and attention are very different concepts. So what I tend to say to people, it may be more appropriate to say attention regulation or self-regulation disorder, because we're talking about multiple things. It's not just that you don't pay attention. And of course, people with ADHD can pay attention, right? So it isn't right to even say ADHD, right? And then not everybody has hyperactivity. So you had the hyperactivity, they go, wait, what? So I do think that we need a better name. But the other thing that's important is that many of the diagnoses in DSM are sort of modeled on diseases like medical diseases, okay? But when you're talking about developmental disorders, that's not a disease, okay? It's a difference in the way the brain integrates.
It's a delay, maybe a delay, not a deficit. Delay.
That's it, exactly. So now for example, now I no longer use the word learning disability. I say differently abled individuals, not disabled, okay? So there's abilities in some areas, and they're different. In some areas, they're not as well developed. And so maybe the future also needs to say that with helping people understand that there's no one right path to success in life, right? And if you're not that good in school, does that mean you can't have a good life? Or if you hate reading, does that mean you're never going to be successful? So it's part of it is channeling you into and it's really about niche, right? Finding the right niche, the right fit.
That's the name of your next book, Finding the Right Niche. Remember, yes, remember, and we will be the first in getting it. So we will forward to the next question, if you don't mind. What have you achieved getting actively involved in this field? And did you find cultural, social, gender, or age conditioning on this path?
Well, I think what I've discovered, I think that I've contributed the most is helping people to look at things from more than one perspective and to see that, we're not one dimensional or we're not two-dimensional, that human beings have many, many sides to them. And even the concept that we were saying a few minutes ago of ADHD, that's not a singular concept. In it's many different components to understanding and I would say to appreciating the complexity, okay, of our work with our patients, and to try to give people a sense of hope in the middle of demoralization. Because I think the biggest challenge is if your brain doesn't work like people expect it to, or like you would like it to, it's very hard to accept that and to understand it and to feel comfortable with it, right? There's a certain amount of fighting that. And in my mind, the question that still remains to be seen is, you know, how do we get people access to help? Because we have so much a fragmented system of healthcare in the United States. And even the division between physical health and mental health is terrible, right? Because then it puts people into silos, into different categories, and it doesn't look holistically. So, you know, what I'm thinking in the future is that, you know, people who have attention deficit or other neurodevelopmental disorders will be able to be not just given medication, but given therapy, given skills, habilitation. You know, instead of rehabilitation, it's habilitación. You know, how do we help you live better? And having access to those skills. Now, what I love about the internet, for example, is that it allows us to make those possibilities within people's reach.
Yes,
you know,
it's so,
and we can develop different ways of sharing knowledge, which we are doing now. And we can also help people learn how to inform themselves without being constantly distracted. The problem with the internet and social media, the gift of the social media is that you can keep connected with people. But the challenge, and to me, this is the thing I've been talking about the most lately of the culture, is how distracted we become with, you know, all of our social media, the notifications, you know, Facebook and this and that. And so we need to start to, again, discuss how do you find a way to master the technology instead of letting the technology take over you. And that's going to be the biggest challenge.
We should work in prevention, because what you say is so important for me, because multitasking is for everyone, not just for ADDers or how we talk to ADD people. It's like multitask is some kind of a course for our lives, because we are constantly stressed by so much information. So I would say myself, I delete the notifications, I put them out. So I go to the phone, I go to my computer, and not this comes to my attention span and distracts me. So, but we should encourage parents and teachers to work with that too, because that would be a very important thing to develop from the very beginning of your life, right?
And being able to celebrate the successes then.
Yes.
Okay, because, you know, if we think about it, it isn't easy to learn to master anything, but it's especially hard if you have ADD or a learning difference or autism or whatever. And so, you know, instead of trying to focus just on achievement and what can I do, it's how do I also become more comfortable in the present, in the here and now, and appreciate. And the pandemic has taught us a lot about this, you know, because we've had to suddenly adapt to a new set of circumstances. And in some ways, you know, I think people with ADHD who tend to think outside the box and don't care as much about the way that old things are, they may be some of our innovators in terms of saying how I can begin to solve a problem in an old problem in a new way. Okay.
Well, maybe what you were saying, I'm sorry, maybe what you said before, that you think how to deliver this like program instead of treatment, it's like more a developmental program. Maybe internet and different sites, different professionals could open this and get connected from different places, because as you said, pandemic shared a new way that we all can be connected online. So maybe this is something we really need to focus, that we can be open to many places. Many places in South America do not have not only a doctor, but someone, psychologist or pediatrician that knows about ADD. So training families, understanding that their traits or these characteristics are from a neurodevelopmental disorder, could make them make the request. We need more professionals trained to help us. It's not just treat us, help us.
I think that's key. I think being able to offer through tele, you know, classes and counseling and all kinds of new strategies. I think that's important. I think
we are too delayed in that.
Yeah.
That's why. Well, if we can share the last question. Well, this is talking about like the future, because you were talking already many of these things, but on which step from the way through your ADHD road would you say you are today? And what do you imagine the ADHD field to be like in the future?
Well, so I still see myself as learning, right? I have an open mindset. I've spent a lot of time trying to understand the phenomenology and experiences of people who are, you know, on the whatever the spectrum we're talking about, ADD spectrum, learning disability. And I think that the current state is that we are less judgmental in the society of people who are neurodiverse. So I think that neurodiversity itself has, for me, become one of the social justice causes, right? That we talk about having a society that allows different people from different backgrounds to have a place, okay? Mm-hmm. And that we need to include in that discussion the needs and the rights of people who are neurodiverse. So where I think that where I am right now, in addition to my sort of interest in continuing to find better treatments, because that's always on the agenda, you know, can we improve our medical treatments? Can we improve our psychosocial treatments? Can we develop apps and other tools that will help life be easier for people who struggle every day to stay organized or to get things done? But right now, I'm very interested in this other idea of creating a more tolerant environment of people with neurodiversity and multiple paths towards success, so that success is not defined in one way, but rather, you know, thinking about it in different dimensions, you know, different developmental aspects. And then where I think the field is going to go in the future, we're going to understand a lot more as we go about the interplay of things like the genetic vulnerability of people to developing these disorders and the role of the environment. In particular, I'm interested in the problems of trauma and of dislocation and the stress and the role of toxic stress and how to intervene early when you see the stress going on. Because even something as basic as going to school and learning in school can be extremely stressful for people with ADHD, to the point where school becomes for them a hostile environment rather than a positive and supportive environment. So the more we see that, the more we understand that the impact of the interaction between individual and the world around them, the more we understand the epigenetic aspects of these disorders, the more we can intervene and the better way we can intervene, okay? Because if you can remove toxic stress, that'll take part of the negative outcomes. It'll reduce the negative outcomes. If we can increase social support, that'll also improve. If we can find new ways of getting kids to learn instead of all in the same way, that again gives more. And then if we can create pathways to transitions to adulthood. So I think the challenge for me, what I'm working on right now, is especially with young people who are leaving high school and trying to move on either to college or to some kind of training program, and the difficulty of taking charge of one's life, okay, and developing, all of those self-regulation abilities. And so I do think we need to spend more time looking at critical moments, those transition points. And I'm really interested in the transition from home and or adolescence to a young adulthood.
Independent.
And I believe that's the group that's actually at greatest risk, but they're the ones who's we call it the scaffolding. It gets removed, and then they're not. Are they ready or not? So
and
the question about failure to launch, or difficulty with getting out on your own, seeing that not as failure. I don't like the term failure to launch. What I tend to say is it's getting stalled on the runway. You're trying to fly off, but your plane isn't able to take off.
Yeah.
And why not?
Yeah, it reminds me a patient, 19 years old, a boy, and the transition from school to the university. And he said to me, the world is too big for me. I'm afraid I'm going to fail,
Yeah, and being able to see that. That's a
How
very
smart
realistic
kid.
That's a very realistic
smart
appraisal.
Yes, it's smart. That shows how smart he is.
Yes, he.
That description is just coming from a person. They have this view, very open view. So that's great. We could talk forever, Anthony. We really are, we both are really passionate also for our clinical work. Myself as a doctor, I'm more a therapist, I say, because I love this integrative model. I go with my patients sometimes for a supermarket to teach them how to buy it. So we go together doing this.
Fabulous.
Yes, sometimes you have to get off the office, or maybe sometimes I go to my kitchen because my office is by my kitchen, by my house. And they say, I'm going to show you how I store my things. I'm going to show you because you need to see, right? Now we have internet, I can make a video, but I want them to see the real stuff. I do have ADHD myself. My family is an ADD family, but we have a friendly way of living. Tolerance,
you're a role model.
That's a point. So the last thing we could be talking forever is, what would be, Anthony, your take-home message? If you have to give to our audience a message, we will be so open to share this with everybody. So what would be the message? Or you can say it in Spanish.
Bueno, lo más importante es de bregar con todo lo que está enfrente y encontrar las soluciones, porque los problemas son muy difíciles, pero con la ayuda de la comunidad y de los profesionales, bregamos juntos a encontrar las soluciones.
Perfecto.
The message is there is,
looking for help and don't be ashamed for that.
That would be amazing. So we hope we could
solution-focused therapy.
Yes. Yeah. Oh, that's good.
But it's more than just, when you show someone how to stack their things, or show them how to manage their time, or show them how to deal with disappointment, or how to prepare for the big world that looks so big. Those are all focused on empowerment. ¿Cómo se dice? Empoderar.
Yes.
Y eso es lo más importante, de empoderar.
Y ser positivos y remarcar lo positivo, remarcar los logros.
Quedarse positivo, sí.
Through baby steps, pequeños pasos.
Exactly.
We read all your books. We are really, we have like a fan club here with Eleonora.
Oh my goodness.
Yes, you know what? And we really appreciate so much, not only your work, your passion, your commitment. You are there, still there, coming and learning. I love learning, and think that is also being a better person every day for you and for all the work you do. So,
Well, I really want to thank you both for the work you're doing. It's very important work. I'm very, very honored to be one of your guests.
We have a team. You want to make a network,
Yes.
a work
Yes.
network with
we want
coffee with experts
yes,
from the USA, because here in South America, we need a lot of your expertise and your knowledge, and for our Ibero-Hispanic population, you know.
and we also need to get everyone have access to information, because many of the people that are not getting to a consultation because of very few professionals are working and having this information, everything is almost in English. And we need to just turn off the barriers. We have so many barriers for people to get access for treatment in every single place in all these countries. And our communities, some places are very poor or very abandoned and forgotten. And this is a health issues. It's a public health issue. It's not
really
just a
is.
mental
It's very
health
important. I'm
issue.
so glad you said that, Norma. That's
Yes.
absolutely right.
We want.
I think that's the challenge.
Yes.
That's
and
the challenge. It's not just,
yes.
it is a public health
Yes.
priority. And we have to keep saying that mental health
Yes.
of everyone has to be the most important thing. You know,
That's it.
we can vaccinate and get people through the pandemic, but the difficulties from the mental health side are going to be with us
No.
for a long time.
For a long
And
time,
we
and that is the
gotta-
focus.
We got to
Yes.
keep it, you know, that in the focus, that we're here for as advocates, and you guys are inspiring. So
Yes,
thank you.
okay, thank you a lot. We wish we could be seeing very soon each other. We want to work with you. We want to get connected with you, with Upstart, I was in chat for so many years. I know you
Yes,
work
yes.
with Tom Brown, and we're all connected in the same goal, right? It's
Yes.
being in a better life for everybody. So thank you very much. Thank
You're
you
welcome.
a lot.
Buena
Thank you.
suerte con todo.
Gracias,
Que-
gracias de corazón. From our heart.
Hasta la próxima.
Hasta la próxima.